I want to next show an actual case to outline both what adenomyosis looks like, also compare it to what fibroids look like, and an exact comparison between the two, as well as what happens to patients after treatment and the follow-up and what those images look like. So this is a patient who had very significant pelvic pain and heavy menstrual periods. She was told by her physician that she had fibroids, and the fibroids were the problem. This is two images from her MRI, and in this patient, fibroids were not her problem. Now, she does have very tiny fibroids in the front of her uterus. You can see these very small black circles, and these are on the range of several millimeters, very tiny, and in fact incidental and not part of her problem. And so we see this commonly with ultrasound. Patients have had an ultrasound with their physician. Their uterus is enlarged. This is an enlarged uterus, and that is mistaken for fibroids. Her uterus is enlarged, but it's not due to fibroids. It's due to adenomyosis. And we can see that very clearly. This is a side view image of her pelvis. You can see the white line here. That's the cavity. And instead of the very thin line, as I showed you earlier in a normal woman, this is very thick behind the cavity of your uterus. And as well, it's also too thick in front. So this thick area around the cavity is what's causing the significant pelvic pain and heavy periods. And this is due to diffuse adenomyosis. This is the cross-sectional picture, again, showing the cavity as a white line. And you can see this really thick, dark area behind the cavity. The front of her is at the top of the image, and the back of her is at the bottom of the image. So again, very thick area behind the cavity, just as I showed from the side view, very thick area behind and also thick in front. And that's what it looks like on the representative MRI images. And I'll next show you what happens after treatment when the patient undergoes embolization. Because with uterine artery embolization, it will treat both conditions. It will treat the fibroids as well as the adenomyosis. But if this were tackled surgically and the patient is under the impression her problem is fibroids, these cannot be removed surgically. The margins are not as sharp as for fibroids. So if surgery is performed on this woman, they would not be able to remove the adenomyosis, and either she would be closed after being surgically opened, or she would have to undergo a hysterectomy. And neither of those options are obviously good for this particular patient. The embolization is much better in that it will treat both conditions. It will do so without any surgery whatsoever. She'll go home the same day with a Band-Aid and have a brief recovery. So here's that same patient, again, from the side view image, showing the enlarged uterus, showing the thick area of adenomyosis, particularly behind the white cavity, but also in front, as well as a couple of tiny incidental fibroids. We performed the uterine artery embolization procedure, and then 3 months she came back to see us, and all of her symptoms were gone. No more heavy periods, no more pelvic pain, and we obtained the MRI. This time we obtained the MRI with contrast. And so with contrast, the uterus is alive. It has a rich blood supply, and that's why patients can get pregnant and have children after UFE. And you can see on this image, also from the side view, a couple of very striking findings. One, you can see that the uterus is much smaller now. It is actually a normal size uterus again. So it went from a woman that was 3 or 4 months pregnant size uterus to a now normal size uterus. As well as you can see the uterus itself is enhancing with the contrast. So the uterus is alive and has a blood supply, but the area of adenomyosis is no longer enhancing and dramatically smaller than that seen over here. And that's why the symptoms in this patient got dramatically better and disappeared essentially entirely. This is the same patient now from a cross-sectional view before we treated her with embolization and after. And again, you can see the enhancement of the uterus, but no enhancement in the adenomyosis area and no enhancement in the tiny residual fibroids. And again, all of her symptoms resolved.